We have medical directors for both facilities. As you know, we have Dr. Thomas Lally for Saddle Rock, and we have Dr. Brooke Allen in Glenwood Springs. Generally, once we get a referral that someone wants to come and potentially move into our facilities, the medical directors are going to be assessing those residents prior to move-in. Now, the referral will be made to the medical directors, and they're going to send, they're either through telehealth or some sort of safe distance visit, establish baseline symptoms, and assign a risk level to this resident. Now, the risk level is going to be either low, high, or a known positive at this point. A low risk will be 1, high will be 2, and a known positive will be 3. So what we want them to do is a 14-day at-home quarantine, starting with the initial assessment. And what's going to happen is there should be no visitors during this quarantine period at home unless it's caregivers only. And they are not to be leaving their house. We want the quarantine to remain at home. The 14-day quarantine will start, and the medical director's office will be assessing that resident every 3 to 5 days to see whether there is any increased chance of exposure, is there any new symptoms going on, and depending on what is happening, the 14-day period could be extended or restarted depending on what their assessment is. We're going to start testing at that point. Now, there's high risk, low risk, and like I said, a known positive. High risk determination factors. If there has been an exposure to a COVID positive caregiver in the last 14 days, if there has been a COVID positive person living with that resident that has not been formally cleared. Another high risk determination factor. Anybody that has visited with respiratory symptoms that is visiting or caring for that resident in the previous 2 weeks is going to put that resident into a high risk. If there's been an ER visit, if there's been a hospitalization, a skilled nursing or rehab visit in the 14 days prior, that's going to put them into the high risk category. And even if there's multiple caregivers coming in and out for routine care, that's going to put them into the high risk determination. Now, if the potential resident does not meet any of these high risks, that's going to automatically put them into the low risk determination, provided they're not COVID positive. COVID positive, then they would become number 3, known positive. And there's different steps we're going to do for each resident depending on where they fall into that. So for instance, say we have a COVID positive resident that wants to move in, the medical director is going to send out and get a baseline done, and it's going to be automatically a risk level 3, which is a known positive. It's going to start with the 14-day quarantine at home will start with the risk level assessed every couple of days when they're looking for new symptoms, new exposures, and we're going to start initiating the first COVID test at that time. And by the end of the 14 days, as long as we've not had to extend it or redo it for whatever exposure may have happened, then we're going to get a second test. So at the end of a quarantine, a previously COVID positive resident is able to move in if there is 2 negative tests and no symptoms, and they completed their 14-day quarantine without a problem. So for the most part, we're going to have the resident that we don't know what their status is at this point. So again, we're going to refer them for their baseline assessment, and they're either going to be a risk level 1 or a risk level 2. Risk level 1 means they have none of those high risk determinations. They've not been exposed to anybody. They've not been in an ER, a hospital, or skilled nursing, and no multiple caregivers for the last 14 days. That's going to put them in a low risk category. After they start with their quarantine, every couple of days, we're going to be looking at it, making sure no new symptoms are coming up, no new exposures. Because again, if there is an exposure or if there's symptoms starting, that quarantine is going to be extended. Towards the end of that 14 days, on a low risk level, we're going to start the testing, and if the testing comes back negative and they've completed their 14-day quarantine at home, they're going to be allowed to move in. Now I'm going to tell you what we do after they move in, after I give you one more case that potentially we would do. If the resident is coming from a hospital or a facility, and this facility has known COVID cases, Again, we're going to establish a baseline. The medical directors are going to be contacted to establish a baseline and assign, they're going to get a high risk level because they were in a facility. If there's, the very last resort will be if we cannot quarantine them at home for 14 days prior, they're going to have to come into the facility as an assumed positive, in which case they're going to need to go into an isolation wing that we have designed, we have set apart on both facilities, and the staff will be wearing full PPE, full personal protective equipment, meaning they're going to be wearing a mask, eye protection, gloves, gown, and minimum contact with outside personnel, and they will need to have 2 tests by the end. So if they were in a hospital or they were a previously known positive COVID, they're going to need 2 negative tests before they get off any kind of isolation. Now, say you have a resident that has been cleared, they've done their 14-day quarantine, there's been no new symptoms, no new exposures, they've got their negative test, they're good to go to move in. We're going to move them in. Now, once they move in, we are, again, have a special new resident quarantine wing. We're going to be putting them in just for the first 14 days. They have to have a low risk score and negative testing. It's an isolation wing, and it's got dedicated staff for the first 14 days. We're going to make sure there's strict adherence to any kind of hand, respiratory, and cough hygiene. Whether we observe them, educate them, the staff is going to be working with them. And if possible, not all residents can wear the face mask. We're going to have them wear their face mask. And they're going to be monitored daily. Either if they're assisted living, we're going to do self-monitoring. If they're memory care, we're going to have the facility monitor them for symptoms, for any new symptoms that may come up during that 14 days. So you may wonder, why, if they just did a 14-day quarantine at home, are we quarantining them again for 14 days in the facility? Well, two big reasons is a lot of the research out there, they really don't know enough about this virus as to when it's contagious and when the viral shedding that makes them contagious actually stops. I've seen research that says it can take up to 22 days on an asymptomatic, meaning somebody showing no signs of symptoms, for them to still be at risk of contagion. So by doing the 14 days at home, the 14 days in the facility, and if they've still completed all that with no new symptoms, then they're going to be good to go ahead and join the rest of the residents. And besides, we can do a more controlled isolation for any kind of exposures or risks, and we watch their symptoms more closely when they're in-house.